what's up? Welcome back to my channel, futureregisterednursern.com. Today what we're going to be talking about is management of patients with upper respiratory tract infections or disorders, not necessarily infections. So, let's get started. The upper respiratory tract is going to consist of the nose, the paranasal sinuses, the pharynx, the larynx, the trachea, and the bronchi. First, we're going to be talking about the nose, and we're going to start off with rhinitis. Rhin, or rhin, or however you say it, means nose. Just think about a rhino, rhinoceros, they have a huge nose, so that's how you're going to remember this. Itis, inflammation. So, rhinitis. This is Tommy, he has rhinitis. He has a very, very, very red nose. His nose is dripping. Rhinorrhea, he has watery eyes, he's sneezing, he has a fever, he has a sore throat, basically common cold symptoms, rhinitis. Next, we're going to be talking about rhinosinusitis, which is going to be inflammation of the parasitial and nasal cavity. So, this is going to be pretty similar to just rhinitis, except this is going to be mostly focusing on the sinuses. You're going to have a lot of pressure over here because you're going to have a whole bunch of congestion, lots of thick mucus everywhere. You're going to feel really bad. And so this can be split into bacterial and viral. So for the viral, you're going to have a low-grade fever lasting more than 10 days. And with bacterial rhinosinusitis, you're going to have a high-grade fever lasting less than 10 days. That's important to remember. Probably an NCLEX thing. You're going to have a cough, facial tenderness, congestion, bloody nasal discharge. Bloody nasal discharge. Okay. Right. Next, we're going to be talking about pharyngitis. Basically, this is going to be a very, very sore throat. We have acute pharyngitis, chronic pharyngitis. Acute, you're going to have no cough. Chronic, you're going to have a cough. Your throat's going to be very red, very sore. It's going to look like my backpack. Pretty dark. Use face wipes, cup, or your drug book. It's going to be red, guys. These patients are really going to want a soft or liquid diet. Anything to relieve their soreness from their throat. Cough drops, warm saline gargle. Alright, we're back at one super duper fun one. It's going to be tonsillitis and adenoiditis. Something about with it. Yeah. Okay, so anyways, tonsillitis, it can definitely extend to the middle ear, causing acute otitis media. That one we should know. You're going to have a sore throat, fever, snoring, difficulty breathing, and earache because it could spread. You want to know that whenever you have a tonsillectomy, you want to avoid milk products, no straws because you're going to stick it down their throat and rupture something. You want to be on the lookout for signs and symptoms of a hemorrhage for the first 8 days. Most common cause is strep A. So laryngitis, it's going to be inflammation. Ignore this. I'm still not sure whether I actually want this or not. Sure y'all can relate. Laryngitis, inflammation of the larynx. So this can be caused by using your voice too much, yelling at your boyfriend, yelling at your girlfriend, yelling at your mom, just yelling because you hate nursing school. From walking outside and inhaling the outdoor pollutants of your school. Inhaling the outdoor pollutants of the world. It's going to cause hoarseness, you're going to lose your voice, you're going to wake up and your throat's going to hurt really bad in the morning, and it can become better with warmer climates, like, just move to Texas. That really doesn't help, but one thing for these patients, like patient teaching, would be do not stop corticosteroids abruptly. If I could spend, 10 minutes talking about that, I probably could, but I only have 10 minutes for this whole presentation. So now we're going to be talking about obstruction and trauma of the upper respiratory airway. First, we're going to talk about obstructive sleep apnea, which we have been getting, tortured with since we started fundamentals, guys. So we should all know what this is. I'm still going to read my notes, though, just so I can get everything. So it's going to be apnea during sleep due to repetitive upper airway obstruction, obesity, men, or being a man, advanced age, all that is a risk factor. So if y'all didn't know that your muscle tone is reduced at night, that is one of the reasons why this is happening. So, whenever you wake up and you're like, gasping for air, yeah, but imagine that happening at least 5 times every hour. That is one of the signs and symptoms of sleep apnea. You're going to be losing breathing sensation for more than 10 seconds, snoring really loud, all that stuff. The 3 S's are snoring, sleepiness, and significant other report. Basically, your wife or your husband is just going to be talking crap about how bad you snore and how bad you wake them up in the middle of the night. Next, epistaxis, however you say it, nosebleeds. So I went through this my whole childhood. It sucked. Basically, you want to hold your nose like this, lean it like that, and hold it for like 5 to 10 minutes, probably over a toilet or a sink, or have something with you. Wow, thank you. This helped me so much. The most common fracture of the face is a nose fracture. Who would actually think? I think, yeah, that kind of makes sense. So you want to have reduction preferred within 3 hours. Complications of a nose fracture would be hematoma, infection, abscess. Alright, almost done but not done. Laryngeal obstruction. So first and foremost, the larynx is a very, very tight box. It's like a stiff box. Does that make sense? I closed the door because, yeah, you're not going to be able to breathe. You're going to be hypoxic. You're going to be suffocating almost, probably. So basically, you want to get to the source of what's causing the obstruction. So is it from allergic reaction? If that's the case, they're having swelling in their larynx, you need to give them epinephrine. Do they actually have something in there? You need to be going like that. Let me do this again. You need to do the high neck remover. Yeah. So, some things y'all shouldn't see. Oh wow, that's super close. I'm going to be talking about, lastly, cancer of the larynx. Homework. Cancer of the larynx, so it's usually going to be a squamous cell carcinoma, and signs and symptoms would be hoarseness for more than 2 weeks, a persistent cough,